Okay, welcome back. I hope you enjoyed your lunch and breakout sessions, as well as checking out the poster sessions. We have a great afternoon ahead. First, I'm thrilled to introduce Heini Utunen, who is head of the Learning and Capacity Development at the WHO's Health Emergencies Program. She will share her thinking on what needs to happen to better prepare health systems for the next health emergency and how all of us with the ECHO community can help. Please welcome to the stage Heini Utunen.
Good afternoon, everyone here in the room, and hello to everyone in the Zoom. It's really a great honor to be here today and in this amazing atmosphere of all of us, friends of Project ECHO, and all of us who belong to the ECHO family. I've been really astonished by the stories I've heard already thus far today, and looking forward to more stories of the work that takes place in all corners of this continent, but also in all other continents. And I'm here from the World Health Organization to really congratulate the incredible 20-year journey so far. And so much has been achieved and accomplished, but still so much more is to be done. We've heard this morning from Dr. Sanjeev how lives have been changed and even saved. And this mission of Project ECHO really speaks to us in the World Health Organization in our pursuit to save lives and make the world safer. And this is an area where we've had an honor and privilege to partner with Project ECHO in the past years, and I'll talk about it a bit more. If we look at the 20-year-old people, they are adults already, mature, but still curious and ready to conquer the world if needed. And I think this is the sentiment I get from the ECHO, ready to really go and do more, and really happy that we are able to join you in this journey. The World Health Organization is 75 years old this year, and we work across the world. We have 10,000 staff in 135 countries, and our Pan-American Health Organization, that is the regional health organization for the Americas, is actually older than we are. They are 120 years old. We all belong to the same WHO family, where our main task is to produce technical norms, standards, and guidance for public health. We hold about 800 different standards for vaccine compositions, maternal care, clinical management, and many more. And only in the past few years, the emergencies program was added to the WHO's work areas. Traditionally, we've been working in the universal health coverage and the healthier populations work area. And following the drastic multi-country outbreak of Ebola West Africa, that actually embarked the rationale for the health emergencies program of the World Health Organization to be established. So my affiliation in the World Health Organization is only 7 years old, and in the emergencies program, I'm leading the learning unit. Therefore, the learning stories, all teach, all learn, really speak to me and is very close to my heart. In the world of health emergencies, every year, the World Health Organization investigates about 500 different disease outbreaks, most of them occurring in the African continent. Hundreds of novel pathogens, all prone to epidemic and pandemic development, are found every year. We are trying to ramp up the work in training adequate numbers of health workers, in particular in Global South, in order to be able to better detect, investigate, and really contain the infectious diseases. This is at the heart of our work. We work through a legal framework, the international health regulations, that provides how countries ready and prepare to any health event, any adverse health event, epidemic, pandemic, health hazard or crisis. We are in a drastic need to train large numbers. For us, in the World Health Organization, the pandemic wasn't a question of if, but when. We knew it was coming. For the past years, we've been preparing ourselves, working with the WHO member states in preparing us for the worst type of a scenario, a global pandemic. And when it first started, the first signs of the pandemic emerged in January 2020, we were already equipped with the one-directional learning platform, openwho.org, to respond to the learning needs during the pandemic. In January 2020, we had about 100,000 learners on our learning platform, and we thought we had covered the most critical workforce we needed at that time. Currently, the same platform hosts 8 million learners, and we've really upscaled the learning response in the past 3.5 years. We host 50 different COVID-19 learning resources, everything from mass gatherings to risk communication to infection prevention and control, facility treatment design, long-term care, you name it. We also host learning resources for 35 other infectious diseases, out of which 10 are the most pandemic-prone diseases that can emerge as the next pandemic. We host learning in 75 different languages because comprehension is critical in making resources accessible and understandable for populations and respondents in need. And we have the top major world languages on the platform, from Bahasa Indonesian to Hindi to Hausa to Kanuri, Swahili, Nigerian Pidgin, also Finnish, the language of Finland, which is a small language, my language. All of our learning has been low bandwidth adjusted, adaptable. The content can be contextualized and used in formats that the responders in the front line need them. And we have a session tomorrow at 3 o'clock to talk more about this work. But what we've done in our work in the pandemic learning response is really the knowledge only, the first knowledge component. And here is where the Project ECHO comes to the picture. We had a drastic need to organize dispersed classes for our responders in various topics. And without the Project ECHO, we wouldn't have been able to manage the demand of interactive peer-to-peer classes that were facilitated by our experts or other experts in public health. And this is an area that we've really explored together, and the amazing results were only achieved because the ECHO model was here. And I remember myself first time entering the Zoom, still trying to figure out how to use Zoom. I'm from the information science background. I should be very savvy, but things are not always so simple. And I joined our African region integrated disease surveillance and response training program, where there were thousands of people simultaneously online in the ECHO classes, surveillance officers, infection prevention and control personnel, responders, laboratory diagnostics personnel, others, online. And I remember the moment when we were split into the breakout rooms and it all worked smooth. I had an assistant director general from one Ministry of Health in Africa leading my session, and it was such a life-changing experience for me to have an online session, synchronous session that was so well planned, designed, and executed, and it really ran beautifully. And from there, I think, not only me, but those thousands of learners, our health workforce in African region, we all benefited from that program. And later I read that one of our Ebola outbreaks in the Democratic Republic of Congo had been actually stopped because of the capabilities that derived from the Project ECHO classes. And I think this tells you the impact that when rightly designed, planned and rolled out, the classes for health responders can be really efficient and effective. So this is the background. We have similar stories from the pandemic. In the late 2020, we had provided the knowledge courses on openwho.org for vaccine rollout purposes, and needed to host courses for the personnel on ground who were deploying the vaccines in the countries where they first were deployed. And Project ECHO again came in, helped us bring together the learners who had completed the knowledge component and now needed more, the next level skills building learning. And this was done at the heat of the pandemic, and Bruce and the team were staying cool at all times when we were in panic, and they assured us from the day one that everything gonna run smooth and we didn't need to care about the instructional design, about the session delivery. We can really just bring our experts from in-house and everything will run good. And so did even those vaccine rollout sessions, live sessions run. So all this is just to say that the Project ECHO has really made a huge difference for us in the World Health Organization and the learners who have come to seek for a bit more than just the knowledge component. And by doing this all work, we've actually, the Project ECHO has worked across all areas of WHO's work, in the universal health coverage area, in the healthier lives, in the emergencies area. We have great learning sessions. We've run more than 400 learning sessions on antimicrobial resistance, on nursing and midwifery, on the immunization for COVID-19, HIV, AIDS, sexually transmitting diseases, infections, and it's been really an enjoyable journey. The teams in WHO are often small. A science team in WHO is usually 2 people strong, and these 2 people leading gender-based violence or Ebola or other health area, they cannot possibly mount operations. They need support in terms of tools, technologies, innovation, how to make the reach and access available. And what we heard this morning from Dr. Sanjeev and Dr. Douglas was that the health equity is at the heart of the work of the University of New Mexico. And so it is for the World Health Organization. This is the year of health equity for us. So we are aligned also in the thematic of making health accessible for all. We've so far reached almost 200,000 learners in these live classes, and each of them have been as amazing as the African Integrated Disease Surveillance and Response session that I got to participate. WHO's member states, territories, and entities are far beyond the normal list of countries. We are calculating more than 230 entities globally, countries and territories. And what we've seen in our online learning world is that the more remote the place is, island states are the most savvy. The most keen learning uptake is actually on the remote islands. And this speaks to the fact that through the digital bridge, we can reach everyone, and it's really powerful. Also, the fact that we've been able to run sessions in more than 10 languages together with the ECHO staff has been really amazing, and WHO teams have been really amazed, as all of us have been, to see that this all has been able to happen. So based on all this, we've really drilled down to say that we will work together. This is a commitment for us to work together in training not only 200,000 health workers, but probably 2 million, if not 20 million. This is the era of pandemics. What we've seen in the past 3 years has probably been a small exercise ahead of what may come. All the changes in the world's ecosystem, the climate, the interface between human and animals tells that the pandemics are going to hit during our lifetime, not once, but many times. We need partners like the ECHO project to help us in upscaling and bringing learning to those who need it at the right time, at the right place. And we really wish to establish a ready, willing, and able health workforce that is not afraid, but feels invested and capacitated to respond to any health hazard that is ahead of us. And us, in the WHO, we are small teams, we couldn't do this without really the great organization and the way the Project ECHO can upscale and bring communities and people together, like us here today, but also much beyond, and really to contribute to the learning in the world. And because of all this, we've taken a bold step and started establishing the Institute ECHO as the WHO Collaborating Center. The WHO Collaborating Center is the most profound way of collaborating with WHO. It's the formalized agreement where us in the World Health Organization partner with a willing institute for a duration of 4 years and establish a work area together. And it's my great pleasure to inform that as of 23rd of August this year, the Institute ECHO of the University of New Mexico has been designated as WHO's Collaborating Center for digital learning in health emergencies. And this collaborating center is first of the kind. We've never had anything like this. We have many medical areas covered in the collaborating center's area of work, but for the first time, we have a collaborating center in Institute ECHO to really work on learning and really to work in the most demanding area of work in health emergencies with us. And I think the Institute ECHO colleagues are not only brave, but they are also so able to navigate even the bureaucracy of WHO. It has taken us 1.5 years to establish this collaborating center. And what I have today with me is the formalizing letter of this collaboration. And I would like to invite Dr. Sanjeev, Dr. Bruce, and Lauren, who are behind this work, to come and receive this letter from our Director General to your leadership. And this, at the same time, we've established this collaboration that is so well-deserved status for the University of New Mexico Project ECHO. I know we in the WHO, we are going to be winners in this collaboration. We've already experienced so many results we possibly couldn't have done without you. But I also call for action, everyone here in the Zoom and beyond, to join us in ideating and working in how to best reach the front line of health emergency response in all events that are looming ahead of us, and thinking through what could be the learning use case for the world where we all could be safer when our, not only health workers, but also all populations understand the threat of epidemic events or any health hazard. So come to join us in this work, and really look forward joining this ECHO community and working with you all. Many thanks.